Cancer often does not kill all at once. It begins with one abnormal cell that escapes normal control. That cell multiplies, forming a tumor that grows larger and more disruptive over time. The most dangerous cancers are often metastatic, meaning some cells break away and travel to new places. Once inside the blood or lymphatic system, cancer cells can spread through the body. If even one of those cells settles elsewhere, it can begin a second tumor. This is why advanced cancer becomes so serious. It can invade several organs at the same time. Cancer becomes fatal when it takes over an organ that the body cannot live without. One common problem is obstruction. A tumor can block the normal flow of food, waste, or fluid. In the digestive system, that blockage can prevent proper digestion and absorption of nutrients. As pressure rises behind the blockage, the bowel can become stretched and damaged. In severe cases, the intestine can perforate, meaning a hole forms in the bowel wall. When that happens, bacteria and waste spill into the abdomen, creating a life-threatening emergency. Cancer can also block important ducts, such as those in the pancreas. If pancreatic juices cannot drain properly, they begin damaging the pancreas itself. This can trigger pancreatitis, a painful and potentially fatal complication. When cancer spreads through the lungs, there may be too little working lung tissue left. The lungs depend on millions of tiny air sacs to transfer oxygen into the blood. If those air sacs are destroyed or compressed, oxygen cannot enter the bloodstream efficiently. At that point, breathing may continue, but the body still cannot get enough oxygen. Without enough oxygen, the brain, heart, and other organs begin to fail. Another major cause of death is infection. Cancer weakens the immune system. Chemotherapy can save lives, but it may also suppress the bone marrow that makes blood cells. Sometimes the cancer itself invades the bone marrow and crowds out healthy cells. When that happens, the body loses its ability to produce enough normal blood cells. First, red blood cells fall, leading to anemia. Anemia means less oxygen is carried to tissues, which causes weakness, exhaustion, and organ stress. Second, white blood cells can drop, making it harder to fight off infection. Even an infection that would normally be manageable can become deadly in this state. Third, platelet levels may fall, and the body loses the ability to control bleeding. Without enough platelets, even small bleeding can become dangerous. This is how advanced cancer becomes overwhelming. Several critical systems can fail together. People often ask why doctors cannot simply remove every tumor with surgery. The answer is that many tumors grow in places that are too dangerous to operate on easily. Even if most of the tumor is removed, just a few remaining cells can grow back. That is why cancer treatment often combines surgery with chemotherapy or other therapies. Modern treatment can control cancer for months or years, and sometimes much longer. But if the cancer continues progressing, the body may slowly lose the ability to cope. Cancer can also harm the body in another way, by altering metabolism. Many patients lose their appetite, not because they are giving up, but because cancer changes body chemistry. The body may stop using food normally, even when calories are still taken in. This wasting process is called cachexia, and it causes rapid loss of fat and muscle. Cachexia does not only affect appearance. It can weaken the heart itself. It can also weaken the muscles needed for breathing. As muscle is lost, the risk of heart failure and respiratory failure rises. This is especially common in advanced cancers of the digestive tract and pancreas. So when someone dies from cancer, the final event may be different from person to person. For one person, it may be organ failure because a vital organ has been overtaken. For another, it may be respiratory failure because the lungs can no longer oxygenate the body. For someone else, it may be sepsis, when infection spreads through the bloodstream. And in others, it may be profound wasting and weakness that the body can no longer survive. When treatment can no longer stop the cancer, care does not stop. The focus often shifts toward comfort, dignity, and quality of life. Good pain control is one of the most important parts of end-of-life care. Strong medications such as morphine are used to reduce suffering and ease breathing distress. These medicines are not given to cause death. They are given to relieve pain and improve comfort. Comfort care also supports emotional needs, family communication, and the patient's sense of peace. In the final stage, the body gradually slows as oxygen, nutrition, and organ function decline. The final moments are usually the result of the body becoming too weak to keep all systems going. So cancer may begin as uncontrolled cell growth, but death usually happens through the complications it creates. Understanding these mechanisms can make a frightening process easier to explain and easier to face with compassion.